This episode is brought to you by Blueprint Health. Blueprint Health is a measurement-based care platform for mental health providers. You can find out more about them by going to practiceoftherapy.com/blueprinthealth. And also this episode is brought to you by TherapyNotes, therapynotes.com, the leading electronic health record system for mental health providers in private practice. They're who I use in my practice. Check them out at practiceoftherapy.com/therapynotes. Hello, I'm Gordon Brewer, and welcome to the Practice of Therapy podcast, where we explore the business and clinical sides of running a private practice. Hello, everyone. This is episode number 229 of the Practice of Therapy podcast. I'm Gordon Brewer, and glad you've joined me for the podcast. And if this is your first time listening in, welcome. Glad you found us, and hope you'll come back for some more and take time to follow us or subscribe to the podcast wherever you might be listening to it. Looking forward to you hearing from my guest today, Ashley Comegys. And Ashley was actually on the podcast before, and I was going back and checking, and it's been longer ago than I thought. It was episode number 143. So I think, if I recall, it was about the time we were just really heading headlong into the COVID pandemic when that came out. And so a lot of folks pivoting, or maybe it was before then. I need to go back and look. But we talked about online therapy, and it was just really becoming a new thing to everybody at that point. But now, I think post-COVID, or hopefully I can safely say post-COVID, maybe not for real, but anyway, online therapy has kind of become a norm. And one of the things that Ashley has really put a lot of emphasis on is helping people learn how to network and do marketing based on online therapy. And in particular, those therapists that are moms or parents that are out there juggling all the stuff and working from home and doing therapy online, she's really created a network around that. And so you're going to get to hear more about that from Ashley in this particular episode. So before I get to Ashley, though, I'd love for you to go over to practiceoftherapy.com/webinars and have put together some free webinars that you can find located there. We're going to be adding to it more later this year. It's hard to believe we're already into May, so I'm feeling a little bit of a time crunch to get some things out. But anyway, looking forward to you checking those out. If you'll go to practiceoftherapy.com/webinars, and you'll see on that landing page the free webinar offerings that we've got for you to. And all of those are automated webinars in which you pick the time at which you get to watch the webinar or take part in the webinar. And so be sure and check that out. And also, before we get to my conversation with Ashley, I'd love for you to check out my new podcast, kindnessandcompassion.com. And you'll find it if you'll just go to do a search on your podcatcher, Kindness and Compassion podcast. It should come up for you, but I'm getting those episodes out and have had a lot of great people and people you've heard on this podcast take part in that one. And in that podcast, what I'm doing with that is it's really geared more towards the general public and not so much niche specific, but it's really teaching people how to incorporate more kindness and compassion in their lives. And we also look at the intersection of psychology, spirituality, therapy, all of those kinds of things, and how it relates to practices of kindness and compassion. So I want to commend that to you, kindnessandcompassion.com, and you can find out all about that particular podcast. And also, real quickly here before we get to my conversation with Ashley, love for you to check out our sponsors of the podcast, and those are Blueprint Health, and you can find out more about them by going to practiceoftherapy.com/blueprint health, and also TherapyNotes, and you can find out more about them by going to practiceoftherapy.com/therapynotes. And here's a little more about those two wonderful sponsors.
As your practice grows, the systems and processes you have in place will keep your practice running smoothly. That is why it is important to have an electronic health record system that is specific to mental health providers. TherapyNotes is a complete practice management system with everything you need to manage patient records, schedule appointments, meet with patients remotely, create rich documentation, and bill insurance right at your fingertips. Their streamlined software is accessible wherever and whenever you need it. They are who Gordon uses in his practice. And did I mention that they are one of the top-rated EHRs for mental health private practices? Their support is also second to none. Be sure to check them out at practiceoftherapy.com/therapynotes. Be sure to use the promo code GORDON to get 2 months free. Running a great behavioral health practice is hard. Payers are demanding more measurable outcomes, therapists are harder than ever to hire and retain, and clients expect a digitally enabled care experience. Introducing Blueprint, the all-in-one measurement-based care platform that helps behavioral health providers grow top-line practice revenue, increase clinician satisfaction, and deliver more effective care. Blueprint's intuitive platform administers, scores, and charts hundreds of symptom rating scales to give clinicians deeper insights into how clients are progressing. And you may be eligible to earn additional reimbursement for each administered outcome measure. Get your first month of Blueprint free by going to practiceoftherapy.com/blueprinthealth.
Well, hello, everyone, and welcome again to the podcast. And I am so glad to have back with me Ashley Comegys. Welcome, Ashley. It's good to have you back.
It's good to be back, Gordon.
Yes, it's been a bit since we were just kind of chatting before we started recording. That it's probably been pre-pandemic when we talked last. And I know you've had a lot of changes going on and that sort of thing. So for folks that don't know about Ashley, why don't you start with just telling folks about yourself and how you've landed where you landed?
Yeah. So I'm Ashley Comegys. I'm a licensed clinical social worker currently located in Tampa, Florida. My practice is completely online and I work with women with anxiety, helping them to navigate life transitions such as motherhood, military life, grief, trauma, and loss. My practice has been online since 2019 I went solo practice, but I've been doing online work since about 2014. And I am licensed in Louisiana, Florida, Colorado, and Hawaii. We are a military family. And so the online practice has really helped me to be able to continue to have a career while the military requires us to move around for my husband's career. So that's my practice side. And then I've been really working on supporting other mom clinicians and other women, empowering them to help grow and build their online therapy practices. So that way they can have the time freedom and flexibility to have that career and also kind of have that family life.
Yes. And one of the things I think about for you, Ashley, is that you really kind of started into online therapy before it was really kind of something that we were kind of pushed into doing. I think for some people, they felt like that with the whole COVID pandemic and all the changes around everything. But it's as you have kind of gone through all of this with all this, I know one of the things that we were talking about ahead of time, I know there's two things that I want us to try to hit on. Is one is support through all of this, because I think as I'm thinking, I'm kind of thinking out loud here. One of the things is that I think for a lot of clinicians, both moms and dads, you had to kind of juggle being at home and doing school and all of that sort of thing with kids, and try to do that overlap of all the stuff. And then also just how marketing your practice has changed, and networking and getting support. So I want to hear your thoughts on all of this.
Yeah. Well, and I think we were talking a little bit too or as you mentioned, like, a lot of us were thrown into the world of seeing clients online because of the pandemic. And a lot of us have decided either to continue doing that or are making the switch to add it as a hybrid of seeing people in office or, and online. I also know a lot of moms who, because of exactly like you talked about, and dads too, where they were maybe working for a clinic or working for an agency while also trying to parent and homeschool and all of that stuff, and got a glimpse of like, okay, what would it look like to work for myself? And you know what, I need more flexibility in my career. And so have started going the online, private practice route. And so yes, it does not look the same as just marketing a brick and mortar practice, because it does require relationship building that's not always in person. And I think one of the really cool things about being online, right, is that you can see somebody in any part of the state, but that also means you can build relationships with other therapists and providers and network with them in other parts of your state too. So it's not just going around and knocking on doctors' office doors nearby, but thinking a little bit, I guess it's kind of globally, but like depending on what states you're licensed in, how do I build connections with people there, even if I'm not physically present there?
Right. And I know you've had just a lot of experience with that, just being licensed in multiple states and really establishing a practice that is purely online.
Yes, completely online. Yeah.
That's great. So how do we need to think differently? I mean, and thinking about if you get down to the brass tacks of networking and connecting with people online, my kind of go-to, I think about, you do it through social media. Are you finding that that's the best way, or are there other ways in which you find are good to connect?
Well, let me back up a bit, because I feel like even before we think about like, how do we connect with people, I think we have to also kind of check in with ourselves of like, what do we think about when we come to networking? Because I think when we're talking with people, whether we have an established practice or we're building a practice and, we hear you're supposed to network, I think a lot of us start to kind of like tense up and we're like, network, like we have this idea of that networking means either that knocking door to door with on a doctor's offices, or it's going to a network mixer, right? And spending this time like, bumping shoulders with people. But really, like, what does that time actually give you? Like, how fruitful can that be? And I feel like I know from my experience, like grad school and early, like, practice building, that was kind of the thing of like, go do these things. And so I think there can be sometimes a resistance around networking because I don't want to do those. And so kind of checking in with ourselves of like, do we have just one specific idea of what networking is, quote unquote, supposed to be? And so how can we kind of think of it differently? I'm very big on relationship building and thinking like, where's the low hanging fruit? because especially for moms, especially for dads, parents, and let's be honest, even if we aren't a parent, if you're in practice, time is of the essence. We're limited with time. And so we need tools and connections that aren't going to require us to go to that networking event that's an hour out of our night, an hour driving each way, right? So in thinking about that, yes, I think social media can definitely be a way of building some of that connection. I think finding, people that are in your niche. So let's say you specialize in working with veterans, and let's say you work, you're licensed in Oklahoma, finding, who else is licensed in that state, who else is working with veterans, and building a relationship with them. Because I think one of the things that we need to think about is that this is a mutual relationship. It's not just us going and saying, give me something, right? Like, give me clients. But how do we look at this as like a mutual kind of symbiotic relationship? I love, doing Zoom coffee chats, as I call them, where, it is easy to kind of want to just hide behind, the computer, so to speak, but the keyboard more so, and, send those DMs and just say, oh, this is what I'm doing. But it's in building a bit of a relationship that I think when I have a client that fits what you're looking for, I'm going to send them to you. So finding those people in your niche, and if it is through social media, which is definitely a great way to get a sense of where those people are, who those people are, say, hey, I see the work that you're doing. I'm also in that niche, working with that client population. Would love to jump on a Zoom coffee chat with you, and keep the schedule short. Like, tell them 20 minutes, because I think that is more likely to get that response. And it also helps so that your time is protected then too.
Right. Yeah. I've got so many great thoughts running through my head as you were talking about all of that. You're right with the idea of networking face to face. Although I will say that is my preference. But one of the things that you reminded me, I was on a consulting call yesterday with one of the people I consult with. But one of the things that they were talking about in their practice is that they had they had a group practice, and they were really thinking, okay, how much do I want to expand? How much more do I want to take on? And what we were talking about was the fact that they said, I really don't see my niche as working with children. We don't really have anybody in our practice that works with children. Should I expand to working with children, or bring on people that are working to work with children? And I said, yeah, you could do that. But one of the things that might be better is to contact other therapists in your area that you feel comfortable in referring to. Yeah. And that's one of the best, word of mouth like that is one of the most effective networking tools of anything. I just recently had to get a roof on my house. And so how did I find a roofing company? Well, I talked to my neighbor who had just had their roof. Who did you use? And so that's how we connect. And that's really what networking's about.
Well, and I love that point, because I think that's where I feel like mental health professionals are really good at overcomplicating stuff sometimes, myself included. And exactly what you're talking about, that it is the relationship, and it is, like I said, where's the low-hanging fruit? I mean, I think, how many times have we had a friend say, hey, I've got a cousin or a neighbor that's going through something, or they lost their mother and they're needing someone to talk to. Who would you recommend? Right? They're not always necessarily coming to you as, needing you as their therapist, but who would you recommend? And so when you are networking and building just relationships with other people, if your friend knows, hey, Ashley sees clients for grief, when her neighbor asks, do you know anybody for grief, then they can connect to you. And I think exactly to your point, I always, really encourage, and this is part of that, like, we don't always have a lot of time to network, but who in your kind of easy, close kind of sphere can you, let know, hey, I have this practice, or, hey, yep, I'm in this specific niche or niche, however you want to say it.
Yeah.
And I'm thinking people like your friends, your neighbors, your church, whether it's your pastor or, another religious group that you're a part of, people that you're in community with. I even, my own doctor, whenever I take my kids to the pediatrician and they find out I'm a therapist, do you work with kids? Right? Because they're people that they always have parents coming, saying, I need somebody for my kid. Or if you work in, maternal mental health, your OBGYN, they're always looking for somebody to refer out to. So again, it doesn't have to be this like super formalized, network of, even bringing, cupcakes and stuff to the doctor's office, but just at your own appointments, letting them know, hey, this is something I do. And, I can give you my information, leave it at the front desk if that would be best. But it really is about that relationship, because like you said, you're going to want to know from your neighbor, who do you trust for your roof? Right. And they're not going to say, well, this guy was bad, so you should probably go to him. Like, they're going to recommend somebody that they trust.
Right. Yeah. And that's that's the whole bottom line to networking and marketing and that sort of thing is positioning yourself in a place there where the people that are looking for, people are already looking for help.
Right.
It's going on all the time, is positioning yourself in a place where people can find you easily.
Exactly.
Yeah. And and you're right that those relationships are so key to that. I just as we're recording this as well, I just got done being at a conference, first face-to-face conference I've been to, the Faith and Practice conference that was done by Whitney Owens. It was so good to connect with those other therapists face-to-face, but I can promise you that if I get, and it happens quite often, people will come to me, oh, I've got a brother or sister that's having trouble and they live in such and such. Well, I'm going to remember those people that I connected with that I can refer them to.
Exactly. Well, and I think to that point then too, like one of the, one of the beauties of online practice, exactly like you were saying, like I may live in Tampa, but somebody says, I've got, a relative in Jacksonville, Florida. Do you know of a therapist there? And maybe that person is wanting in person, but maybe they're open to online. And so that opens up the, vast majority, or just opens up to more possibilities for therapists. And in that same way, there are more clinicians, and I definitely, let me asterisk this, I don't advocate for just going and getting more state licenses, but there are therapists and providers who are licensed in multiple states. And so having connections of like, okay, yeah, I do know that this person is licensed in Oregon, or I do know of somebody who, sees clients in California. And I have them as a referral source. And then the other part of that too, I think we are in a more global transient world now. And so, I think back, especially to the beginning of the pandemic, where a lot of people who work with college students, where they were getting sent home. And there was a lot of this question of like, can I continue to work with them because they're not in a state where I'm licensed? And, I know there has been there is, the compact law that's kind of trying to push for some of that. And there are some states that will allow it, but a lot of times it's, no, I can't. And so who is licensed there? Or we have if you work with military community, they move a lot, or, even if it's not a military family, somebody else who travels for work. Right. So knowing, okay, I've got somebody that they are in the same type of field that I am. They do the same type of work. Maybe they want someone that's EMDR trained because you are. I've got this connection built there. So that way it can be an easy kind of warm handoff versus just here's a number, kind of call them.
Right. Yeah. So lots to think about with all of those things. And I think that, again, you're going back to what you said earlier, it's all about building relationships within our field. and
Yeah,
the
no, it
importance of that.
definitely is.
That's again, not to get too far off on a tangent, but I was just reminded of a conversation I had with another therapist as well, and just how, I think traditionally in years past, a lot of our contact with other therapists and stuff were through our trade organizations, like ACA and National Social Workers and AAMFT and those kinds of things.
Yeah.
But some of those kind of organizations are not as much in the forefront as they once were. And so people are connecting in other ways.
Right. Well, and I think, like those are great events to like see people or connect. But I think unless you're kind of going in with the mentality of, I want to build a relationship with a person who is licensed in this area and working with this, that it can sometimes feel a little futile. I mean, I think of after I graduated with my master's, the university having like an alumni night during homecoming. It was come and network with one another, and like we got some, free drinks and good food, but there wasn't really relationships built there. And it does take an intentionality. And so like to your point of, in face-to-face networking versus, through the computer, I think being clear of what is it that you're wanting to build in this relationship, right? If you are somebody who you're still in the process of growing your practice and you're reaching out to somebody that's licensed in a state you're licensed and saying, hey, I just want to share a little bit about what I'm doing. And if you happen to have too many referrals or somebody that's not a good fit for you for whatever reason or availability, please send them my way because I do have openings. I mean, I know a lot of us can relate to, there's just a flood of constant referrals the last few years. And a lot of us are like, I want to help as many people, but it's then to our detriment and burnout. And so how can we support one another in our practices where there are people who do still need clients? And we also need to be able to refer to people that we know, again, it's not just a name. It's actually, again, that relationship that we have a trust built with them.
Yes. And I know, again, just to change gears a little bit, I know you and I were talking ahead of time. You're really putting some stuff together to help people with that whole problem. You want to talk about that?
Yeah. So I recently launched something called Village, which is a community for women and mom clinicians to network and refer with each other. And the idea is, we always say it takes a village, and that in our practice, in our professional lives, we need that village too. And so what the idea is kind of three or twofold. So kind of what I was saying, where there are those of us who we are getting more referrals than we can even answer the phone for. And what do we tend to do when we get those, people seeking help? We either say, go check Psychology Today, or, I'm full, and I don't know anybody else, or we go post in like a Facebook group. And I always say, we hope that the unicorn finds it, right? Because we are wanting somebody in this state that takes this insurance, that is for, works with this population. And it's just a hope that maybe somebody sees that, right? They may not even be in that group.
Right.
And so I know a lot of us have really struggled the past couple of years where we know people really need help, but we also have to have boundaries and say, I can't see everybody, right? And so then you have the other need that I've been seeing is that there are those who are saying, I'm ready to leave that clinic I've been in, or I'm, coming out of maternity leave and raising kids, and I'm wanting to start a practice, or I have started it and I'm really needing more referrals. I'm having a hard time finding them. And so how can we kind of address these two problems together? And so Village was created to help support one another in that, right? As someone who has more referrals than I can handle, I want to support somebody who's trying to still build their practice, right? Like I want to give them to you, and send a referral your information knowing that you have an opening, right? Because a lot of times if we're just, saying, go check out on a directory or something like that, we don't know if they're going to get an answer from that provider or if that provider is full. So it's this idea of how do we, again, support one another to empower each other in our practice. And so it's this ability to refer out and to gain these referrals. And then the other exciting part of this community is that as we are building these relationships, one of the things a lot of times clinicians, especially women, I find, struggle with starting practices like, well, if I decide to have a child or I'm pregnant, what do I do for maternity leave? And when you're in solo practice, there's no backup team, right? And so building a relationship and networking with other providers is a way to help have coverage for that, right? So it's not this, who do I look for? But when you join Village, you have access to all of the providers that are part of that. You're able to search to see, who is licensed in Alabama, is willing to cover maternity leave, who is licensed in, Wyoming and has openings, and you're able to then connect with each other. So that way, again, it's a symbiotic relationship of support. Because again, like we need to build the village. We need to circle the wagons and support each other in this.
Yes, it's a brilliant idea, Ashley. I was just thinking about, I've got a clinician right now in my practice that's will be going on maternity leave in a few more months. And so, and so I was just thinking, we're a group brick and mortar practice, so it's a little different. But this whole situation of being online, you just don't want to abandon your clients and all that kind of thing. And so, I love that. I love that idea.
Yeah. Well, and even if you are brick and mortar, but if you're by yourself, right? If you're in solo practice and not in a group, how do you have, it may not be that if a client is in need during your maternity leave, that they're going to be seen in office, but that there is somebody else that can support them during that time. And the thing too with this is it's not just about maternity leave, but also about family emergency leave. I know many clinicians who suddenly they've had a family member pass away or a kid gets sick, and they're like, I cannot be there for my clients during this time. What am I supposed to do? And so having those relationships built, having this place that you can easily go to say, I'm looking for this specific type of provider, and building that relationship can be so helpful so that it's not another crisis during a time of crisis for you.
Right. Oh gosh, I love this. So tell folks how they can connect with this.
Yes. So if you go to bit.ly/Village Therapists, you can read all about Village and you can sign up there. I've made it super low cost. It's $5 a month just to help make this an easy thing. And if you use the code 3VillageFree, you get your first 3 months for free.
Awesome. And we'll have those links here in the show notes and stuff for people to access easily. Well, Ashley, I want to be respectful of your time, and this is just some great stuff. And I really think that you've got a great concept here for people to build on and to be able to really kind of be able to embrace this new kind of online world and really building successful practices online.
Yes. Yeah. I'm excited for where things are and just to continue to support everybody in this.
Yes, that's great. So tell folks again how they can get in touch with you if they want to connect and again.
Yeah. My website is raisedtoempower.com, which will be, I'm sure in the show notes. And then I also have a Facebook group called Moms Building Online Therapy Practices with Ashley Comegys. I think the link is in the show notes too. Yes. So you can head over there and join us there as well. But those are the best and easiest ways to connect with me.
Yes. And again, like you said, all that'll be in the show notes for people to easily access. So, well, Ashley, I hope we get together sooner rather than later. Thanks
Yes.
again for being on the podcast. And we'll also have links to Ashley's first interview with me, which is, again, a few years ago. But as I recall, our conversation was around being practicing in multiple states. And so I think it's a good reference point for people. So we'll have links for that as well. So I hope to see you again here soon, Ashley.
Me too. Thank you, Gordon. It was such a pleasure talking with you.
Well, again, big thanks to Ashley for joining me in this episode of the podcast. And be sure and check out her things by going to bit.ly/village therapist. And you can find out more about what she has to offer there. And there'll be links here in the show notes and the show summary for you to access that more easily. You know what I love about folks like Ashley is just finding those needs that are needed in our communities and really figuring out a way to kind of solve the problems. And I think she's really recognized the importance of being able to find support, particularly for parents or moms and that sort of thing that are juggling all the stuff with taking care of kids and also trying to run a business and doing all of it online and that sort of thing, and being able to have an outlet to connect to those to other people to get that support that we all need. One thing I'll say is that none of us should be going this totally alone. Seek out support, seek out mentors, seek out peers that are going to help you in this journey, because as you probably well know, this can be very hard and challenging work, especially helping our clients, helping our patients deal with the things that they're dealing with. So again, check it out. Again, links here in the show notes. And thanks again to Ashley for joining me for this particular episode. Also, before we go, I'd love for you to check out the free webinars that I've got available, and you can find out more about them by going to practiceoftherapy.com/webinars to find out about those free resources. And you can just also go to practiceoftherapy.com and find out about all the resources that I've got available for folks. We're still working on getting some revamps to the website and getting some new stuff out there, new content, and maybe a new look to some of the different landing pages that you'll find on the website. So be sure and check it out, practiceoftherapy.com. And also, as a reminder, check out our sponsors, Blueprint Health, and you can find out more about them by going to practiceoftherapy.com/Blueprint Health. And also TherapyNotes, therapynotes.com, or you can go to practiceoftherapy.com/therapynotes and find out more about all that they have to offer. TherapyNotes is the leading electronic health record system for mental health providers in the private practice space. So they're who I use in my practice, so can't say enough about them. So they're great folks to know. So take care, folks. Glad you joined me. Be sure and take time to subscribe or follow us wherever you listen to your podcast. So glad you're with me on this journey. You have been listening to the Practice of Therapy podcast with Gordon Brewer, part of the PsychCraft network of podcasts. Please visit us at practiceoftherapy.com for more information, resources, and tools to help you in starting, building, and growing your private practice. And if you haven't done so already, please sign up to receive the free Private Practice Startup Guide at practiceoftherapy.com. The information in this podcast is intended to be accurate and authoritative concerning the subject matter covered. It is given with the understanding that neither the hosts, guests, or producers are rendering legal, accounting, or clinical advice. If you need a professional, you should find the right person for that.